Hi, my name is Joseph Perales and I'm going to talk about the prognostic subgroups among patients with step 2 colon cancer. Introduction stage 2 adenocarcinoma of the colon is a common and curable cancer, depending on features of the cancer. 60 to 75% of patients are cured without evidence of cancer recurrence following treatment with surgery alone. Many people who has colon cancer ignore the symptoms and end up with much worse cancers type 3 and 4, which the rates of survival is lower and much more hard treatment has to be made.
Don't ignore these 5 signs of colon cancer. The types of colon cancer are very dangerous. These types are not the deadliest, but they are really serious. In 2016, about 140,000 people are diagnosed of rectal or colon cancer. One of the main issues is that most of the people wait until it is too late for the treatment. This happens because the people usually ignore the symptoms. Today, we will present you 5 signs of the colon cancer. Cramps. This symptom is easily overlooked because the cramps happen because of some other health problems that are not connected with cancer. But, if you feel stomach cramps, it does not have to mean that it is cancer. But, if the cramps are intense, long-lasting, and they don't want to go away, and if you have some other symptoms of colon cancer, you have to see a doctor as soon as you can. Fatigue. The fatigue is usually overlooked because it looks less serious than it might be, but, because of the rapid way of living, this condition is not a surprise, because many people feel fatigue because of lack of sleep. But, if the fatigue happens too often, you should visit your doctor. The fatigue and the cancer are associated because the cancer cells use the energy of the body. Sudden weight loss. If we talk about dramatic and sudden weight loss, it can be a sign that different types of cancer can be present, but of them is the colon cancer. The cancer cells use the energy of the body cells, but it can affect the immune system that fights the diseases. Because of this can happen unexpected weight loss. But, when we talk about the colon cancer, also there is a chance that a big tumor can block your colon that can affect the bowel movements and also cause weight loss. Irregular bowel movements. Most of the people don't pay enough attention of the bowel movements. The appearance, consistency and timing of these movements can show different problems with your health, including the cancer. The colon polyps, which is a small amount of cells that can turn into cancerous cells, start to affect your bowel movements if they turn into tumors, and these tumors are able to affect the function of the large intestine and it can cause some changes in your stool.
Applied to medicine, the current standard of clinical prognostication relies principally on pathologic staging. First, in early stage colon cancer stage 1 and 2, all the tumor is contained with the wall of the colon. Less than 10% of patients with the stage 1 disease have a recurrence, and adjuvant chemotherapy is not administered because it provides no benefit. Second, approximately 20% of patients with the stage 2 colon cancer have recurrence, and chemotherapy provides a little benefit that it's usually considered to be not worth the toxic effects of the drugs. Among patients with the stage 2 disease, there is quite a range of rate of 5-year survival as low as 60%, depending on the incremental depth of tumor invasion. Stage 3 colon cancer have regional lymph nodes metastasis. Cancer recurs of more than 50% of patients, and multiple clinical studies have shown significant increases in survival with the administration of adjuvant chemotherapy. Patients with chemostatic stage 4 colon cancer receive a variety of more intensive regimens that are not usually curative.
You ready?
Julie Carrillo is no stranger to cancer.
My father is now in his fourth year fighting pancreatic cancer. My grandmother died at 54 with colon cancer, and I was actually unaware of that until I was diagnosed.
Hey, Julie, how are you?
A nurse with a medical background, Julie's gut told her something was wrong.
My first doctor actually looked at me and said, "You're too young, this can't be cancer, don't worry about it."
But fortunately, I think she was empowered to seek additional opinions.
Doctors discovered stage 4 colon cancer. She went into emergency surgery the same afternoon.
It was shocking at my age, especially. I was 39 years old. I have two kids, two teenagers at home.
Surgeons removed all but 4 inches of Julie's colon, but there was more bad news.
It had already spread to her liver at the time of diagnosis.
Again, she went into surgery to remove 70% of her liver, along with 4 tumors. Then came chemotherapy.
A year after her original surgery, she developed a new spot in the liver and had a second liver operation.
How could this happen? A study in the journal Cancer shows colon cancer rates increasing in younger patients. In fact, 1 in 7 cases is in people under 50. And in a majority of those younger patients, the colon cancer has already spread by the time it's detected.
And we are seeing that more and more frequently.
The cause might be genetic differences, according to a recent University of Colorado study, but research is ongoing.
I've been very blessed, had an amazing outcome.
For now, Julie is enjoying her cancer-free days as a wife and a mother of 2 teenagers who are now aware of their potential risk after having family genetic testing.
Bounced right back up real quick.
Together, they have a lot to look forward to.
You can't be so consumed and so scared of dying that you just quit living.
The pros and cons. Pros: on patients with stage 2 colon cancer and confirm that CDX2 negative cancers as compared with CDX2 positive cancer were associated with significantly lower rates survival, 48 to 51% versus 80 to 85%. So with the right prognosis, the expectancy for life is bigger. And cons: more money invest with no warranty, and improvement can be made, or worse, they ignore symptoms and doesn't expect colon cancer at all.
I was 43 years old when I was diagnosed with stage 2 colon cancer. I'm married, I have 4 children. At the time, they ranged from 16 to 7 years old. This is the last thing I expected. I'm a police officer, I'm in relatively good health. I never had any problems. I never was really sick with anything other than a flu. But I noticed that I had a cold that cleared up, but my cough stayed with me. I went in to get checked out. The first thing I had done was a chest x-ray, which showed that I was clear, that my lungs were clear. I had no problems in my chest. My doctor recommended that he draw some blood. At that time, he drew blood, and he recommended that I go home and we wait for the results of that blood test. Well, a day later, he called me back up on the telephone while I was actually on the golf course golfing and said I needed to come back because he believed the lab made a mistake, that there was no way possible that this was my blood work. I knew, being in law enforcement, being around hospitals, being around blood draws, that something bad was happening. It was very rare that that would happen in the lab. I felt, or I thought. After I went back the following day, we drew blood a second time. Within 3 hours, my doctor called me up and said he needed to come in. I needed to come in. I needed to talk to him. First thing he said when he walked in the examining room was that this could be something very minor or something very serious. He thought it probably was an ulcer, and I told him that I wasn't stressed out, that I didn't feel that, an ulcer, I had an ulcer, that this would cause bleeding. He said I was highly anemic and that something was going on and I needed to get another further test, a battery of tests done. He recommended an endoscopy. He thought it was an ulcer. He thought that would probably show that what the problem was. We set it up about a week later. I went for the endoscopy, and that was clear. The GI doctor that I went for the endoscopy said, well, it's not anything down, your throat or your stomach area. He recommended we do a colonoscopy. At that point, I became highly concerned. I still didn't feel that, I still didn't think it was cancer at the time. You never believe or think you're going to get cancer. I never believed that it would be cancer, but I knew that something was going on. I was 43 years old, and I knew that my blood work should not be so out of line. So I went in for the colonoscopy. I had the colonoscopy. The doctor came back into the room, and he calmly said to me that he had found a tumor in my right ascending colon. At that time, at that point, I just couldn't believe it. My wife was in the room with me. I just looked at her. She looked at me. I was 43 years old. I did not know how to act. I was shocked. He told me he had scheduled a CAT scan for me the following day, and I had to go get a CAT scan. He wanted to find out how far along the tumor was, if it had, I guess, invaded other organs. The worst thing I did when I went home is that I obviously started, probably like a lot of other people, I got on the internet and started reviewing colon cancer, read about the stages of colon cancer, and absolutely, better terms, freaked out. I was highly scared. I couldn't believe it that I had cancer.
For an interactive tool to learn more about your colon cancer and your personalized
Applied in Ecuador, a database in Ecuador says that approximately per year there are 1,200 cases of colon cancer, so cheap